Welcome to this episode of Movement Medicine Podcast. Thank you to everyone that's tuned in for the previous episodes. We really appreciate all the feedback we've received so far. We really hope that you've enjoyed the episodes and the guests that we've had on, and hopefully you've been able to action some of the recommendations that they've had, even during this lockdown period where we're all restricted to our homes. So we thank our partners for the podcast. That's the Fit India movement, the Back to Fitness Clinic, which is the clinic that Rajat runs, La Ultra The High, which is the race that Rajat puts together in Ladakh, and also the Moving Mountains Within Film, which is the film about the 10th edition of La Ultra The High. So I'll pass over to Rajat, who will introduce today's guests.
Thank you, Darren, and thank you everyone yet again for checking into another episode of Movement Medicine. And today we have a special guest, Dr. Pankaj Surange. We've known each other for a while, for the last 12 years. Amazing guy, great at what he does. And welcome, Pankaj. And why don't you just jump right away into your academic and professional background, please? So just tell us, what have you been up to so far?
Yeah, so I did my schooling from Gwalior, my hometown. Then I did my basic medical graduation, that we call it here MBBS, that I did from GRMC Medical College, Gwalior. After that, I joined Army as a medical officer, as a short service commission officer. I served Indian Army for 5 years. So that is where I have actually started going into the fitness, basically what I learned, what fitness is there. Because we were mostly as a short service commission officer, we were mostly into the field areas, in the high altitude areas. So there I understood the meaning of the fitness, what is the fitness meaning. So I served for 5 years, and after that I left Army after completing my tenure of 5 years, and then I did my specialization in anesthesiology. I did MD anesthesiology from Army Hospital. After my anesthesiology, I started working as an anesthesiologist. I worked in few corporate hospitals. Then I decided to go for the super specialization. So this is how I decided to go for the pain management as a specialty. So I took this specialty and then did my FIPP, that is a Fellowship Interventional Pain Practice from Budapest, Hungary. And this is how I started my practice in interventional pain management. So my area of interest is mainly spine interventions. So I do a lot of interventions in the spine, minimally invasive procedures for the spine, and also for the joints. And recently, since last 3-4 years, now we also started doing the regenerative medicine also. That also we have included. So currently, I'm having my own setup in Delhi. It's a daycare center. It's in the name of IPSC India. So we have this daycare center, and I've been running since 2012. I'm working there. So this is my background, and also in addition to that, last year I did one advanced healthcare management program from Indian School of Business. So this is just to add my administrative skills. So that is how I'm now going more also towards the management side. So that's my background.
Fantastic. Thank you very much. So you obviously mentioned about the Army and how obviously it was important for physical training and fitness in the Army. Could you tell us a little bit more about that and how you've been able to continue your fitness journey since leaving the Army?
So as I told you that I actually understood what is the meaning of fitness in Army. Before that, definitely we were in school days, we used to play, college days also we used to play. So, but that was just a part-time sort of things. But actual fitness, when I joined Army as a doctor, when I joined Army, I was already 25 that time. So it was really difficult for us, for doctors, to undergo all that rigorous training, because we used to start at 5 o'clock in the morning till 7 o'clock in the evening, and we used to run every day 5 kilometers with all those heavy stuffs on your and heavy boots. So that was a difficult part, but definitely 3 months of training in military training, that gave us a lot of stamina also. And immediately I was posted to high altitude area. So that was my first posting. So in high altitude area, that the oxygen is already less on the lesser side, mountain areas, and you have to go for all the this thing operations and all the uh, borders. You have to search for the borders and all these things you have to do. So with the less oxygen, so this is definitely that gave me a lot of strength also, a lot of stamina also. And fortunately, I was in 5 years, I was 4 years, I was in a high altitude area only. So that gave me a lot of stamina. Uh, Post that, definitely there was a fall in this thing because I joined MD. So MD, it's a very tough job here. You don't get any time for 48 hours, 36 hours. You're just working there continuously. So you don't get time for for your physical fitness. But definitely I realized after a few years after my MD also, I realized that this is the most important thing, I think. The fitness is most important thing. Because when you're telling your patients about a fitness and you yourself are not doing this thing, so it doesn't look nice. And not only that, you should look fit so that patients have a confidence on you. So that also is very, very important, I think. And this is how then I started going to gym also. And every day I go for good walks. I don't go for runs. That is one of my biggest weakness. Rajat know that. He tried a lot, but I just couldn't do that. But yes, definitely I go to gym every day just to keep myself fit.
Thanks, Pankaj. So, where were you at high altitude? Where were you posted?
Yeah, so I did my two tenures in altitude area. So one was the Sikkim, that was Nathula. Nathula, if you heard about
Right.
it, the China border, the China-Tibet border. So I was there for 2 years. So that was basically there were only two seasons, either snowfall, 6 months snowfall, 6 months rainfall. That's it. And that was at a height of 16,000 feet. So that was first tenure. Then after that, I was posted in the peace area, but unfortunately, something happened in India. So in 48 hours, I was asked to move to other area, to the another border. So second, my tenure was in JNK. That was again in altitude area. That was around 12 to 14,000 feet area. So that was a Pakistan border. So this is how out of 5 years, I have spent my 4 years in altitude area.
So, the race that I put together, low, ultra, the high, now that happens from 11,000 feet to 17,700 feet. And, the distances range from now 55 kilometers to 555 kilometers. What do you think about that? How tough is that? Since you actually served at high altitude for such a period, what do you think about that?
So definitely that is as you always advocate this thing that whenever you go for this ultra marathons, it is not that you are just deciding. You have to prepare yourself for at least for 6 months. That is what you also say, yes, I think, Rajat. So this 6 months of preparation is very, very important, and the acclimatation is the most important thing, I think, because we, since we were in a high altitude area, uh, we in an army, you know that at times we don't follow these things because contingencies of the service and all these things, we don't follow that strictly at times, and we have seen the consequences of that. So especially it is very important for the civilians who do not have any exposure to this high altitude areas. So for them, it is very important that they must undergo rigorous training before that. They must go rigorous acclimatation process, and don't then only I think they should venture into such altitude areas. I think Rajat, you must have also come across some cases of the HEPO or the HECO cases. So that is one of the dreaded complication of this thing. 200 kilometer, I am not able to digest, and now you are telling me 550 kilometers. That is too much. So basically, this is all the requirement of the body, the oxygen requirement of the body. Since as we can say that as we go about 10,000 feet, every 1,000 feet we are going by 1% of the oxygen going by that. So if it is uh, if you are at around 16,000 feet, I think the oxygen concentration is very low over there, maybe around 10% or somewhere. So the requirement of the body is there because you have to put more efforts, So your body requires more oxygen and you are not getting that oxygen. The body has some mechanism of compensation, but that also compensatory mechanisms are at certain level they will work. If they are not used to, if you suddenly bombard them with this high altitudes, then in that case the compensatory mechanism fails. And that compensatory when it fails, then you go land up into some problems. So the acclimatization process is basically to tune up your body to all these stressful conditions which you are going to face in a high altitude area, so that body can start compensating for the low oxygen, and then in this way they can cope up with the altitude area. I think that is the main mechanism, general mechanism.
So I was just saying about how obviously it's important to prepare for an ultra marathon, sort of through the ways that we've said, by acclimatizing to the altitude. How important is it to so-called acclimatize for any surgery that you might be having? So as an anaesthetist, obviously, you're aware of certain complications that can happen during surgery. If you prepare in a certain way by doing prehabilitation, so exercise, for example, before surgery, often you can mitigate a lot of those negative effects that might happen.
Yes. So if we talk about the surgery, the pre-surgery, basically you are making up your body for, or preparing your body for the surgery. Now, since I'm mostly into the spine, so let me give you some example of the spine and the joints. Now, when we talk about a surgery, suppose if you are going for some fixation surgery, or if you are going for some joint replacement surgery. Now, what is important here is definitely making your muscles ready to accept that, because once you undergo surgery, after that the most important thing is how you are doing your physiotherapy, how you are moving. So if your muscles are not good enough to support the joint, they are going to give it. If your bones are not strong enough to take those implants, your implants will give it. So you have to build your muscles also, you have to build your bones also. There are some medications which we can build up the bone mass, but for muscle mass, you have to do some little bit of exercises. And the biggest question which comes is that how will you go for the muscle building exercises or some muscle strengthening exercises, because we have a lot of pain. So there comes the role of the physiotherapy and the role of the physical medicine. They can not, if the people are not able to undergo the active exercises, I think the passive exercises will also help in maintaining the muscle tone. And some medications are definitely important for building the bone mass. So these things are important. Apart from, not only from this point of view, the psychological preparation is also very, very important when the person is undergoing surgery. Most of the people, they don't want to undergo any surgery, any intervention. So preparing them for the surgery is another big task. Because if they are not motivated after the surgery, so you have to prepare it from pre-operative period. Prepare them that you will have to undergo these kind of exercises. If you don't undergo these exercises, the surgery might be very successful, but it will be a result into a failure, because you are not doing any regular exercises after your surgery. So this preparation, the psychological preparation, is also very important.
So compared to your colleagues, whether in the army or after that at MD or school time, how are they? How fit, how active are they? And how's your practice different from theirs based on, your background? What do you think?
Yeah, definitely. As I told you that whenever patient enters your chamber, and if the patient sees that a fit doctor is sitting in front of them, then they take your advices very seriously. If you are with a good this thing fat, and obviously they'll not take your advices very seriously. So you should also look fit in front of the patient. Then only you are giving one example in front of them, that see this, I'm 45, I'm 47, and the patient also compares themselves. I see a lot of people who are just 35 or 40 and they look much older than me. As you give the example of my batchmates, I can take my batchmates also, that they look like 50 plus something, whereas we are the same age. So that definitely helps in the practice also. confidence building also for the patient. That is also very important. And what I have seen is that one peculiar thing which I have seen is 45 plus syndrome. That is very commonly we see. And that is where people land up into problem also at times. Suddenly after 45, they wake up that, oh, now I'm in the middle age group. See what I'm doing. I'm fat, I'm not doing exercise. Let me start doing exercises. And sudden this kind of josh and all these things, that is where they'll end up into problem. So again, I will suggest to them also that if you're not habitual for exercises, if you're not done since last 15, 20 years after your college days, don't suddenly jump to the your gymming. That is again very, I think Rajat also support me in this, that this is where they land up into problem. We have seen a lot of patients who are coming in 45 and 50s. When they start doing gymming, they land up into especially the ligamental tears. Ligament, very important. They land up into ligamental tears. They suffer some stress fractures also at times. So it is also again that acclimatization is important here. First, they have to go with a very light exercises, some stretching exercises. Those things are important, I think.
So when people suffer from back pain, a lot of people seek MRI scans in this day and age. Even in the UK now, this is something which is gaining sort of popularity. People are going for private MRI scans. What kind of benefit do you see to those scans in actually helping these individuals with their pain?
Yes, so MRI scans are definitely, I am a big advocate of this MRI scans. Not for the acute cases. Most of the acute cases, we know they are basically coming from the muscle region or the facial region or the joints. So we can definitely manage them with some medication exercises, we can manage them. But if the person is having some chronic pain, in those cases, it is very important for us to have this MRI. Because lot of things we have to correlate. There are so many important structures which are there around this spine area. So we have to pinpoint what is, especially it is important for us. Like when we talk about the interventions, we have to be very target specific. We should know where is the source of the pain. Clinical evaluation is the most important thing. As we always advocate this thing, that you must go for the clinical evaluation first, make your clinical diagnosis, manage the patient. If the patient is not manageable with that, if the patient is going towards the chronicity of the problem, in those cases, it is better to go for the MRI and correlate clinically. There comes the role of the MRI. Or in cases of acute emergencies, in those cases, definitely there is no choice, but we have to go for the immediate MRI.
Thanks for that, Pankaj. Now coming to some more myths and misconceptions in society about various conditions, and since you deal with back pain, one of them could very well be disc bulge is the reason for all back pains. So please just touch on a few of them, please.
So I'll say it is not only with the general population. This is the biggest myth with the doctors also. Very big myth about this, that back pain means slip disc. Even without the MRI, people diagnose it as a slip disc, PIVD. We see a lot of times, every day we see this kind of diagnosis which are coming to us, even without any MRI. Now, how can you just diagnose the PIVD or the disc bulge without even MRI, without any seeing the symptoms? So, when we talk about the chronic pain, the disc bulge just comprises 2 to 5% of the cases. Just 2 to 5%. Disc bulge or the PIVD or the slip disc, there are multiple names people take. So all these are the similar things. So they comprise just 2 to 5% of the cases. Most common problem with the chronic back pain, when we talk about the chronic back pain, is facet arthropathy and the discogenic pain. That means it is not a bulge, but there's some degeneration which has started in the disc. So another very important here is that since we are now aware of the discogenic kind of pain without any one bulge, the degeneration of the disc, which is the cause of the pain, that comprises around 40% of the chronic back pain. Now to diagnose this, pinpoint this thing, we have to have this MRI. There also comes the role of this MRI. So biggest myth is that any patient coming with the back pain is a PIVD. No, that is absolutely wrong. Second biggest myth is that any radiation to the leg, people consider sciatica. This is another biggest myth. It is not necessary that anything which is going down to the leg is because of the nerve compression. Lot of time, in majority of the time, what we are seeing, it is a referred pain, which is coming either from the SI joint or from the facet joint or from the muscle itself. So that also we had, in fact, I'll not say ki for the patients to understand this thing, but it is important for the doctors to understand that anything going to the leg is not a compression of the nerve. It may be a referred pain, and majority of the case it is referred pain. So that is another big myth about back pain. Another very big myth in India, what we have seen is that a lot of patients comes to us with the neck pain and the back pain, and they say that we have been advised to remove the pillow, and maybe so I have back pain, so I'm not sleeping on the mattress, I'm sleeping on ground only. Since last 3 months I'm sleeping on ground, I'm not using pillow. So this is another very big myth about the back pain and the neck pain, because if you do that, you are actually doing harm to your spine. If you are not maintaining that curvatures of the spine, you are doing more harm. Whatever it was acute, now you are putting lot of pressure throughout night, maybe for 8 hours of sleep or whatever. You're not getting, firstly, you're not getting good sleep because you are not comfortable throughout night. And secondly, you are not maintaining that curvature of the spine. If you don't maintain the curvature for throughout night, obviously you are making that acute condition into chronic condition. So this is the third myth which we commonly see, very commonly.
It's 14 hours.
Yeah, and again, Pankaj, one more is about history and examination. Aren't they the most important before we get into these investigations like MRI? If you haven't listened to the story, if you haven't touched the patient, I mean,
absolutely, Rajat. That is what I said, the clinical diagnosis. And clinical diagnosis, so another thing what we commonly see in our practice is that patient comes to us, because since we are dealing with the chronic pains, so most of the patient, they come to us with the bunches of this investigation and the prescriptions, and they will put in front of you and they'll say, see doctor, I am suffering from this. I said, no, this is not your suffering. You're suffering. You tell me your problem. No, it is, everything is there. See my MRI. They'll tell you, see my MRI. So when you ask them, no, you tell me your problem. No, doctor, it is there. Everything is there. Why don't you see? So this happens. We face this kind of problem. But always I tell them, see, I don't want to treat this MRI. I'm not treating this X-ray or the whatever is there with you. I have to treat you. So you have to tell me what you are suffering from. Then only I'll go to some diagnosis. Here there may be on MRI, as Rajat rightly pointed out, on MRI, I'll say that in 70% of the cases, your findings on MRI and your clinical findings, they don't match. They don't match. We see a lot of pathologies on MRI. And if you ask the patient, are you, oh my God, if you see this MRI, you're low, you must undergo surgery right now. And if you ask the patient, no, I don't have any pain, nothing. I'm only having this much pain. I don't have anything in the spine, nothing. So this is very common, very commonly we see. So that is why very, very important. I don't see anything. I just ask them to keep everything aside. Tell me your problem from the beginning. That is also very important. From the beginning, it is important. It is not that today I'm suffering, previously what was there. No, tell me from the beginning, when were you absolutely fine and how it developed and how it progressed. Because that is also very important, because when we are dealing with the chronic pain, we have to see the chronicity, that means neuropathic component. We have to see that neuropathic component in the pain. So that is why it is important. The history is the most important, and examination is definitely your thumb. Thumb is a better MRI. Yeah.
Pankaj, maybe the reason why they're suffering from back pain is because they're having to carry around all their case notes.
That is holding on this thing and having neck pain now. That is true.
So obviously during this lockdown period, when we're all restricted to our homes, is there any advice that you could give to the general population to try and maintain back health?
Yeah, absolutely. So what I'm suggesting nowadays is that go to the basics. Go to basics. Simple. What our ancestors, they used to do. What? Yoga. Very important. I don't know about the Surya Namaskar and the what you call it push-ups. So the Surya Namaskars were there. There was a pattern for doing this thing. So that those things we can do at home. We can do at home. And very important is the posture. This is very, very important because we have seen that lot of young population is getting affected with this early degeneration process. Maybe the joint or the spine, disc, whatever it is. A lot of young patients are coming with this kind of problem, and it is mainly because of their sedentary lifestyle. And now with this lockdown, they have a reason to lie down and working on the computers and just sitting for hours and just lie down. So it is very, very important for them to get up from the chair and walk in between after every 30 minutes. That is what I suggest. What example normally I give to all my patients, especially the young patients, is very important that all your joints, discs, all these have some tissues which do not have any circulation, blood circulation. They are not getting nutrition. The only way of sending the nutrition to these tissues is by the compression decompression forces. So I give the example of the rubber, the eraser what we use, rubbers. If you keep using rubber, it is flexible. You bend it, it will come back to normal position. If you don't use the rubber, what will happen? It will become dry and it will start cracking. Same thing is happening in our joints. It is the same thing is happening on the disc also. If you are not giving this compression decompression forces to our spine or the joints, they are not getting nutrition. They go into degeneration. And that is the main reason why we see a lot of young patients. Rajat must be seeing a lot of young patients. It's actually it's alarming. We are seeing patients in 20s with disc problems, with joint problems, which is actually alarming. It's not good for the society. So they must keep themselves active, do yoga, do stretching exercises. Even if you cannot go out, you can just walk inside of houses also. You have this thing, what we used to do earlier, this thing, what is that called, Rajat?
Skipping.
Yes, that is wonderful thing. So go to basics. Simple things are there. Use them.
Thank you, Pankaj, for joining us on the podcast. It's been an absolute pleasure. So thank you very much.
Thank you, Rajat. Thank you, Darren. Thanks a lot.
Thank you for joining us.
Thank you very much.
Thank you all for watching yet another episode of Movement Medicine. Please subscribe here by clicking here to watch our future episodes. Thank you so much. Take care, guys.